hang up.
Okay, there we go. It has started.
Perfect. How are you guys doing?
Fabulous. We're fabulous.
It's a Monday. We're making it.
Yeah.
Well, what we do before we start, and we always honor the person and tell them why we wanted them on the podcast.
Okay.
And after that, know that there is no such thing as talking too much because this is your time to shine and tell the world who you are. So, Kelly told me all about you as far as what you and Cecile are doing, and I thought it was so amazing that you guys, ladies, I'm gonna go ahead and say these ladies, took the reign and said, "Okay, we got this, and we're gonna make some changes because." With the silos that we have, we with this isolation, we come from a place of if you're doing better than me, then I have to be doing worse, or the competition, or well, you haven't been in the field as long as me, you don't know all of that nonsense, not understanding that everybody has something to contribute to anything that we do if we're willing to listen and respect and honor who they are. So we're bringing you on here because we're excited about what you guys are doing and we want the world to know about it so other advanced practitioners can come about, join you guys and make this world better, especially with sleep, because as those who are in the field, we know the doctors are very limited now. So we need you guys, but we need you at a level that is equivalent to the physician. We do not need you to be delegated and as some errand person, we want you guys to really shine. So Kelly, go girl.
So Maggie, thank you so much for coming on our podcast. When I saw SMAP on LinkedIn, I was so excited for all of you. I reached out to Cecile and I said, this is the best thing I have seen in a long time because there's such a need, especially the need to understand sleep as well as you and the other sleep APPs do. So I just wanted you to come on and tell your story. And of course, definitely talk about SMAP because we need to get the word out there. So thank you so much for coming on.
So thank you guys for having me. I was so excited when Cecile said that she had connected with you guys and hey, I'm all about it. Let's spread the word. More the merrier. Let's get this as a movement. That's what I want. So that's why we went after it. Um, so a little bit about me. I kind of have a side story. Everyone has their story. Mine isn't really magical, but I just knew that I was going to be a nurse since I was a little girl. Age 4 is the timeline that I truly remember that I said I was going to be a nurse. I was putting band-aids on baby dolls and, helping everybody feel better. And that's, as a 4-year-old, what I thought a nurse was. I wasn't a sickly child or anything, so I don't have a major medical, story there, but I just took care of my babies. And so it just continued to grow as I grew that this was my mission and I was determined to get through all of my college classes and become a nurse as fast as I can. So I did that and quickly realized that I want to go further than just bedside nursing. Not that they're not important, they're very valuable, but I just knew that my calling was a little bit bigger than that. So I thought my first line was going to be anesthesia because if I'm truly going to take pain away from patients, I'm going to take it away altogether, right? Knock them out. And so that was my plan. I soared through the plan of, getting into grad school as quick as I can, not wasting any time. And I had an amazing mentor in the ICU. Bedside nursing. He was the internist there, and that's the intensivist. And he was like, "Maggie, what are you doing?" I was like, well, I mean, I'm going to grad school. My papers are turning in tomorrow. Like, what are you asking me? Like, I'm here helping you in a procedure. And he was like, no, seriously, why are you doing that? Again, this has always been my dream. This is how I'm going to help people. This is what I know of how I'm going to take pain away. And he was like, Big, you're not doing the right move. And that was the first time anyone kind of threw that at me. And it stopped me in my tracks. And I said, can you please explain that? And he was like, you are wonderful talking to patients and educating in family and, just kind of teaching them. Because I was in the neuroscience ICU. And so I was dealing with traumas, I was dealing with strokes, I was dealing with all of that, charge nursing and everything. So he got to see the leadership side of me, of how I handled families and manipulated staff and, handled staffing issues and, any problems that came up, life flight coming in, whatever it may be. And he just said, your calling is bigger than talking to a sleeping patient. Ironically, that's what I'm doing, is talking to sleeping patients. His meaning was, more than I needed to be heavily involved with my patients and my family members and educate and teach, not just put patients to sleep for procedures. And so I took it to heart and I said, okay, well, maybe you're onto something. So I shredded up my grad school paperwork and, filled out new paperwork and went for a nurse practitioner. And I never looked back that day. I am board certified family nurse practitioner, but I always have a backup plan. I'm a big planner. And so I was like, well, what if I get bored? I've been in level 1 trauma, family kind of sounds a little boring. So I also, at the same time, I was the only one in my graduating class that postmastered an emergency room NP, just as a sidekick, just to make sure I had all my bases covered. Well, I never to this day had to use my emergency room nurse practitioner. I have been using my family. I walked into my current practice where I'm at under the basis of it's a neurology, sleep, and epilepsy practice. So I walked in with a neurology background, thinking I was going to, fall head over heels in a new aspect of neurology. And little did I know I fell head over heels in sleep. So technically, I am still taking care of sleepy patients, but in a different dynamic. And so I love this dynamic because there's lots of education that goes into it, and you truly can change a person's life when you improve their sleep. I mean, sleep is technically half of our life. And so there's so many medical disorders and disease states and just overall well-being that it evolves around good quality sleep. So I love what I do. I love, helping patients, helping family members. It's not uncommon for me to take care of a patient and then ask questions. And then the next week I have the rest of the family members and it's a whole, family affair that we've taken care of everybody in the group. And so I love it. I love it. I love it. I take the extra time and truly listen to my patients and relate the diagnosis to what they're actually feeling versus just giving them a label. Because labels are important in the insurance and financial world and getting things covered, but it's the patient story that makes a difference to them. And if we can, make them feel as a human and not, lessen their human side by giving them a diagnosis, we know them as a patient versus a diagnosis, and we're better able to treat them. So that's kind of been my passion. And from that, I've realized I have a wonderful doctor, Dr. Gerald Simmons, that I work under, and he's been a great mentor and educator of me and taught me a lot of what I know in sleep medicine. But I knew that the future of medicine in general, not just sleep medicine, is APPs. We are, a big helper. I know that you said that we need to be, even with the doctors. I never want to take their degree away from them, but I do feel that we are more than an aid. We are more than an assistant, and we can help patients, diagnose them, treat them, and take really good care of them, just as a doctor can. So I view us as an extension of the care team. And that, I mean, I have some patients, I've been in my job for 13 years, and I have some patients that they've only seen me. And so, it's not that I devalue doctors whatsoever. I have wonderful doctors and mentors that I work with and I look up to every day, but I truly feel we can be on an even playing field when it comes to taking care of our patients. And so through my journey, I have, worked with different pharma companies and went out into the education forefront of teaching pharma, but also teaching disease state education, and traveled around. I've been published, working with different research opportunities, and I've come to realize that not all APPs have the same journey. We don't all have great mentors along the way. And I feel that there's major discrepancies in how patient care is done, not only with APPs, but in doctors in general. And so I want to help fill those gaps. And I was like, what is a bigger power than me? I love helping patients, but maybe I can help more patients if I can help the providers. And so that's where the dream has come. And so I'm taking it from there, and I want to make a movement. And I've pulled Cecile behind me. She's amazing. I've known her through pharmas where I first met her, and we've worked on many projects together. We've published together. And whenever I knew that I needed my right hand. I knew that there was no other person but Cecile. So I was very excited. And then the both of us have worked very. Cecile and I had worked hand in hand with Heidi Maris with many projects, and we loved her outlook on her vision and how she practiced and her approach with patients. And we were going back and forth, trying to find our third officer. And we ran through some different names, and we all just had a question mark of this or that, and nothing really was like for sure. And then randomly, we both looked at each other in one of our meetings, and at the same exact moment, we are like, Heidi Maris. And we're like, yes, that's it. So we called Heidi, and she was on board, and the three of us never looked back. It's been nonstop since. And here we are. We are off to running.
Tell us more. What does it stand for? What is it all about?
Sure. So SMAPP stands for Sleep Medicine Advanced Practice Providers. So it's a nonprofit foundation that we have set up to support APPs in sleep medicine. We want to improve the awareness of APPs in sleep medicine by enhancing their recognition of the overlap between, of course, sleep health and complex medical conditions. We want to strengthen the communication, and this is a very important one. We want to bolster the dialogue between APPs, patients, and interdisciplinary providers. We need to understand that talking is not just talking. We have to speak the same language. And oftentimes we are not speaking the same language because patients don't know medical jargon, and we don't know how to break it down so patients can understand it in plain English. And as well as interdisciplinary providers, they don't work sleep medicine, so they don't know all of the lingo we use. So we need to really strengthen how we're communicating, and then develop effective strategies, advancing optimal assessment and treatment protocols, advancing evidence-based research, and peer-to-peer clinical expertise. So those are our main focuses of what we, want this foundation to do. We are a group, a nonprofit that's dedicated to developing educational programs, providing professional advancement services, assembling and developing resources for and guided by advanced practice providers. We want to foster that sense of community, bolster APPs in all of our roles, and empower APPs as the future leaders in sleep medicine. We worked hand in hand, really choosing our mission and our vision very, very carefully, because we wanted to make sure we're not just another place that's going to carry a meeting, right? We wanted to really provide the education that is needed for APPs to feel confident in what they're practicing and how they're treating their patients. And we worked and thought about, okay, are we going to take APPs? So that's nurse practitioners, that's physician's assistants, that's clinical pharmacologists. We wanted to look at it and say, do we want to focus on only those practicing and said sleep practices? Okay. Well, when you go through that, there's a lot of people practicing sleep that's not an official sleep practice. So we wanted to make sure that we were not going to limit it to official sleep practice APPs. So that opened up one door. Then the next door we thought is this whole interdisciplinary approach. Every provider sees a sleep patient, whether they know it or not. So we wanted to spread the awareness of, well, how can they better assess their patients and understand that this is a potential sleep problem? And if they don't want to treat it, when do they refer off? And that's where we come in, right? As well as they are taking care of a patient who may already have a diagnosed sleep disorder, but they're treating, let's say, high blood pressure or obesity or autoimmune disease. How is their sleep apnea issue or their sleep issue, insomnia, hypersomnia, whatever it may be, how is it interlaced with the comorbidity that they're currently treating, and how together as a team we can work? So it is for all APPs who see sleep patients, not just at sleep practices. Because I think together, again, everyone supporting each other, we can take care of more patients. And we're not asking every APP to treat the sleep patient, just be able to assess them properly and know when to refer off. Another one of our big things is we wanted to create a toolbox, okay? And a toolbox is, of course, handouts and educational pieces, but a toolbox is also your phone a friend. And so a lot of practices out, in rural areas or in smaller towns may not have practices where we came from in big university centers that they can phone that friend. Well, we're going to develop a system where they have lots of friends in their back pocket and we can help them out and say, hey, I have a patient. I'm not sure what to do. Can you kind of offer me some guidance? So we're going to be the phone of friends and we're going to develop that sense of community so they never feel like they are alone.
Bravo, that is outstanding because again, you feel isolated. And I love the part when you're talking about how you're giving them the tools also when they'll know what they're seeing in front of them. You don't have to just know what you're seeing and you can pass it, hand it off, but at least know. That's so important, as you know, because it's about this much of sleep talk in medical school. So nobody, and they don't want to
Less
listen,
2 hours in all of medical training. So that's pretty tough. So we want to change that. We've worked with the Academy and spoke with them. That's the Academy of Sleep Medicine. And we want to try to change the span of education in not only medical world, but nursing world. We want to get further education out there because it's a huge part of the human being. And so we need to make sure that everyone is educated on that. So setting up some guidelines for that. And just really our big thing is, if we're going to go through all this and provide the education and get it on the website so they can have printouts and whatever it may be, set up educational seminars, on the local levels, we want to go national and we are going to have our national conference. It's slated for 27. We want them to not just come. We want to make it affordable to them, okay, to be able to miss clinic, and we want to make it affordable. We want to make it accessible, but also we want to say, hey, you took your time out of your personal life in your clinic. When you're going to come to conference, we want you to take something home, knowledge-based wise, that you can put into practice that Monday morning when you return to clinic. And that's very important because we often go to all of these conferences and all of these meetings, and they're presenting us research and things in the pipeline, which is amazing. But what can I put into practice to better my patients today? And that's what we want to take them home with.
That's why I love Sleep Trends. Oh, I loved it so much because I'd never been to a conference where I could actually take something. I gave it to them, some of the tools I was given, and it does make a difference. It was wonderful. So bravo to you. Oh my goodness, this is so exciting.
Yes, I'm thrilled. We're pulling in wonderful faculty staff that we're pulling in that's going to help us educate along the way. And our belief, the three of us, Heidi, Cecile, and I, yes, we are the officers in it, but this is a movement and this is something that we're going to do together. So we want all the shining stars so we can spread the knowledge and spread the awareness. It's not about, as you said earlier, who's going to get the recognition. We're doing this for society in general. And if we can make the movement, we're going to help society and sleep medicine health in the future for the long haul. So we want to all work together and make everyone shine.
Yes. That's the reason why we're doing this podcast, for the same reason, because there's a lot of amazing things that are happening out there, and we want everybody to know about it. Kelly, you have any questions?
No, I'm excited to hear this. As I mentioned with Cecile, there's only 7,500 sleep physicians in the entire United States, and we need more APPs with sleep. And what I loved when you said this is not just APPs in sleep medicine. You want to reach out to all the APPs, whether they're in primary care, if they're in endocrinology, neurology, wherever. Have some form of knowledge to start thinking about it, because so many times I see patients that go to primary care that I saw in the hospital, and if sleep is mentioned, it is nowhere ever in the notes. So I assume, what do we learn, all three of us, when we're in school? If it's not in the notes, it's not mentioned, right? Because it could fall back on us later if we ever had to go to court or something. So you want everything in notes. So I think that's spectacular that you're doing that. And also I mentioned to Cecile about primary care. At least where we live, my interactions with the primary care at my hospital area, they're starting to take on the burden of sleep apnea patients because there aren't enough sleep doctors. And they're trying to figure out with the GLP-1s. I think that's why, from one primary care physician said to me, because of GLP-1s, they have to start talking about sleep, or they should, right? Because as one primary care doctor, and I love her, she said, if I'm not talking about their sleep, how is that GLP-1 going to work right? And she goes, I don't think a lot of people realize that. So the burden on that practice. So if they start having more APPs there and you're talking about it, it's spectacular because everyone should think. I told Donnie when I talk to my patients, I tell everyone, think of sleep in a big circle. And Donnie said a balloon, but like a big circle. And around it is everything, right? Blood pressure, heart attack, stroke, wounds, anything, cancer, all around. And if you do not fix
Immune
that
issues,
sleep,
psychiatry issues, all of it is there.
yes. And if you don't fix that sleep, good luck. So
Exactly.
great job coming up with that. I just love it. And I just expect it to take off. And I know we're running out of time. I do want to know, what is the future? What is your future dream for SMAP, sleep medicine, and all patients? That what are you envisioning beyond what you just created with Cecile?
So our vision, of course, we wanted to go big before we go small. So we're going national, and then we're going to work it to the more local community levels. But I would like it to be a well-known name. I would like more APPs to hear about us and want to learn and come on the journey with us. That's the biggest. I want to help as many patients as possible. I want to leave a legacy that everyone knows sleep is utmost importance, and without good quality sleep, the rest of your health suffers. And just touch every APP, empower them to know their voice and use their voice in a way to where we're getting to more patients and families.
I love it. And I'm just going to
Sounds
put this little bird in your ear right on the podcast because I briefly mentioned it on Cecile's. With the vision that all three of you ladies have with SMAP, and I know it's for APPs, but think about this as you grow it. The CCSHs, Donnie and I, even maybe even the sleep coach, and depending on where they are with their education, I would love at some point for you to attend something because it would make me so much. My knowledge would just continue to grow beyond what I have. Though I also know I'm just an educator. I will never cross that line as some type of clinician, but I feel like the knowledge would be outstanding for me to know.
So this is the thing. We are geared for APPs, but our membership is open. You can be a respiratory therapist. You could be anyone, as long as you're in the medical field, right? That wants to learn and take care and better understand a sleep patient. We're not going to close our membership just because you don't have an APP credential behind your name. If you want to learn, please come join us because what you know can help someone else in your practice who will connect and is actually the prescribing and diagnosing provider. I'm going to leave it at that, whether it's the doctor or the APP, whatever it is. If you see sleep patients and want to learn more and you're in the medical field, please go to our website, smapfoundation.org. Become a member. You are more than welcome. Yes, we're geared at APPs, but we are geared for education and empowerment. So membership is open.
Oh, I love it. Say that
That
again.
is.
Where can everyone go?
Smapfoundation.org.
All
Girl,
right.
I don't
Awesome.
know what's up with you, Maggie. I ain't never seen her that excited to talk to anybody. She don't even get all that emotion she just showed. That is not normal. You have done something, put a fire underneath this girl.
Magic. It's SMAP magic.
Well, I want to say this is that Kelly, one of the reasons why you want to go, so you're thinking about even attending is because the level that we're on. Because we're in the hospitals, we're seeing patients, and right now there is no education for that. Right now, that's why we created the clinical sleep health practitioner and that education component because it's a whole nother level and we're all leveling up. It's just amazing to see what we're doing in sleep. We are all leveling up, and ladies, go ladies.
That's it. Empower. We empower each other and let each other shine.
Definitely. Anything
Mhm.
else, Kelly? OG?
No, I really enjoyed this talk, and you can see my passion. I feel like it doesn't really matter how old we are. There's always something to learn, and if I know
Yes.
I can learn something, that's what makes me so excited for our field. So, anything you want to add, Maggie, before we end, that you want the audience to know?
so grateful for this opportunity. And like I said, I can't do this without the help of everyone. So become a member, join, get your interest out there. Let us know if you have brilliant ideas that you want us to put on our forefront. Let us know. We are open. This is for everyone. We want to better the patient, sleep or not sleep. We're here. So we're open and
And
we're
one more
super
time,
excited.
where can they go?
SMAPPfoundation.org. So SMAPP Foundation.org.
Awesome. Congratulations. Thank you
Thank
so much
you.
for honoring us with your presence. And
Absolutely. And come visit us
and
at Sleep. Our table will be there.
yeah,
Oh, I'm gonna be there. I will
she'll
be
be
there.
there.
Wonderful.
Awesome. Let me end this. It's time to end. Stop the recording.